Hi, my name is Gary Blau, and I am the Executive Director of the Hackett Center for Mental Health in Houston, Texas. Prior to this, I was the Chief of the Child, Adolescent, and Family Branch at SAMHSA, the Substance Abuse and Mental Health Services Administration. First of all, let me share my hope that you and your families are well, and I want to wish everyone a happy Children's Mental Health Awareness Day. My hope is that every day is Children's Mental Health Awareness Day, and I thank you for being part of this important work. Now more than ever, caring for every child's mental health is critical. We knew even before COVID-19 that 1 in 5 of our young people will experience a mental health challenge, and that 1 in 10 will have a serious mental health condition that will impact their ability to function at home, at school, and in the community. We also know that half of all mental health conditions manifest by the time a child turns 14, and 75% by the time a person is 24. That is why we say that mental illness is actually a pediatric illness. And while these numbers were staggering prior to the pandemic, we can expect that issues such as depression, anxiety, and post-traumatic stress disorder will persist for weeks, months, and even years to come. Which is why we must seize on the positives and continue to take action. What are the positives, you ask? Well, the good news is that we are talking more about mental health than ever before, and we are slowly chipping away at the prejudice and discrimination that often comes with mental health conditions. We are also seeing an expansion of telehealth that will hopefully continue far beyond this pandemic. The use of telehealth is effective and efficient and has been shown to improve capacity, access, and outcomes. We're also recognizing the connection between physical health and mental health. People with depression, for example, are more likely to have cardiovascular disease, and a person with cancer is more likely to experience a major depressive episode. It's time we all acknowledge and understand that mental health is a critically important part of our overall health. We can't have health without mental health. We're also seeing people join together in a common spirit, and this collective experience has brought us together in unprecedented ways. How many of us have reached out to talk to family and friends over video chat? How many of us have reconnected with people with whom we had lost touch? Once this initial crisis is over, we must focus our attention on our children and the importance of caring for every child's mental health. We want to strengthen and maintain the ability for all of us to talk about mental health freely and openly. My agency has a wonderful public awareness campaign called OK to Say. So as we go forward together, we must remember that it is okay to say when you're not okay. And we all need to speak up and share hope. This is the spirit that brings us together now, and it's exactly the approach we will need to hold us together in the future.